Radiation therapy is a type of treatment that uses really high energy X-rays, and we can use them in a very targeted fashion to target tumors and cancers throughout the body, and we can do that in a way that spares the normal tissues that are nearby. Radiation is sometimes used in what we call a curative sense, and in that goal, the goal there is to completely eliminate the cancer from the body. And sometimes we use the radiation in what we call a palliative sense, where we're trying to alleviate or also what we call palliate symptoms like pain or bleeding or other symptoms that are troublesome to the patient. The first step in the journey for most patients is with something called a CT simulation. We have a special room with a CAT scanner in it, and almost all patients start their treatment process here. We usually set you up in a position that's going to work for treatment. This is highly customized to your needs. And we also make sometimes permanent marks on the body with little tattoos. They're like little tiny freckles that we put because we use lasers to line up to those every day, so we want them to not wash off. We then use special immobilization devices sometimes where we create these custom molds to hold you in the same position each day. And then finally, oftentimes we'll either make marks on the skin or templates, or we'll actually take CAT scans that we can then use later to custom design the radiation to your body and to your cancer. After the CAT scan and the CT simulation, I'll take that CAT scan and maybe even some other scans like a PET scan or an MRI scan, and we bring those into our computer simultaneously. And then I'll take some time and actually draw out everything we want to treat and everything we want to avoid on that scan. And then I give parameters to my planning team for how much radiation I want the targets to get and how much radiation I will accept to the normal tissues. And then we come up with a customized plan, and it's a back and forth between the physician and the planners and our medical physics team until we come up with the very best plan possible for your situation. When you come in for your first treatment, you'll typically enter to our waiting rooms and you'll interact with our front desk staff. They'll get you all checked in. And then if you need to change for your treatment, we have private changing spaces that they'll be escorted to so that you can feel comfortable and store your belongings there while you get your treatment. If you don't need to change, you'll typically wait in the waiting room and waiting areas until they call for you, and one of our radiation therapists will come and get you personally. They'll introduce themselves to you and they'll bring you back to the treatment room. The treatment room, while it looks intimidating, is actually completely non-invasive. The machine moves around you. You don't go into the machine. And they'll set you up in the same position that we set up at that CT simulation day. And the goal is to get you in the exact same position every day for your treatment, because that's the position that we custom design the radiation plan for. And then they'll deliver your treatment once everything's all set. A lot of times that includes some imaging for us to confirm that everything's in the same position. We check your images as physicians on your first day of treatment, and we check all subsequent images every single day that you're getting your treatment. And then once your treatment is complete, they'll escort you back to the changing area, or you'll be free to leave. And I think what's really important is because it's the same team every day, you become very comfortable with people, and you'll become very comfortable with the routine as it plays out. And after a day or two, you're going to feel very comfortable with everything that's going on. As part of your treatment process, you're going to meet weekly with your physician for what we call an on-treatment visit. It's a team meeting with your nurse and your physician. It's typically on the same day of the week. When your physician's not available, there will always be a covering physician on site, and we're always available if anything comes up on any day of the week during your treatment course to address your concerns and any new side effects or problems you might be experiencing. Radiation therapy is a very unique specialty in that we have a very strong team-based approach, more so than in other areas of medicine you'll find. We have teams of nurses, we have physicians, we have radiation therapists, but behind the scenes, we also have radiation dosimetrists who are integral for planning the radiation treatments. We have a medical physics team that does all the quality assurance to make sure that what our computers say they're going to deliver is what our machines deliver to you. And you'll interact with some of these people all the way through, but we take a very strong team-based approach with that whole core group so that it runs very seamlessly from your standpoint, and that you have someone to interact with if you're having a problem or you're having concerns. You'll see the same nurses every day practically. You'll see the same doctors frequently. So there's really a lot of interaction amongst the team that really is going to keep you feeling very comfortable with the whole process. I like to think of radiation therapy as this beautiful interplay between high tech and high touch. Our goal is to give you the most advanced, most targeted treatments available today. We want to make sure that the process is really, really seamless for you and to give you a really quality experience with the entire process.